Good morning and welcome to the Point. As the Michigan State Legislature takes a couple of weeks off for spring break, gives us a chance to catch up with some of those members to find out exactly what they're working on. We start this morning with Republican VerHeulen and Democrat Dillon working on the Department of Community Health budget. It's a big budget. How big is that budget?
Just under $19 billion with a B.
Yeah, so $19 billion, and a lot of that is federal money, but there's also a lot of GF money that goes in there. So we're going to talk about that a little bit today, talk about the process. And I will point out at the outset that we're taping this a little in advance as we're moving into spring break time for those of us who have kids that you got to get away for spring break, and the legislature will take a little break. But this process is interesting because not only is it a huge budget, but there are also some big changes coming with Department of Community Health. Let's start first of all with dollars and cents. Where do you think we are on this process?
Well, as we sit today, the plan is tomorrow for the subcommittee to consider and report out our proposed budget. And so, as you know, Rick, the governor a couple of months ago proposed a full budget, which included a component, which was the Department of Community Health. And since then, we've been taking testimony as a committee. And we've done many hours of work group, which was basically Representative Dillon and I, Dr. John Bison, our other vice chair, and the department and House Fiscal. And we've been going through that budget line by line. And we completed that process a couple of days ago, and we've crafted a budget which we will present tomorrow, and hopefully it'll be reported out, be considered eventually by the full House. The Senate's doing the same, and then we will reconcile the two budgets and present a unified budget to the governor.
For those of us who don't deal with it on a line item basis, when I say Department of Community Health, what am I really saying? What kind of things do you deal with in this budget when you're going through $19 billion of line items?
The largest chunk of that is obviously Medicaid. That's a huge portion of that community health budget. That includes both the state and a large federal component, but we're talking about things like public health, preventative health care services, other things that people might not always access, but things that are very important, making sure that our hospitals are safe, making sure that children that have special diseases are able to get the services they need. But the largest chunk of that budget is really Medicaid.
And that, I assume, was impacted by the passing of Healthy Michigan?
Oh, very much so. Very much so.
Which was an expansion of Medicaid that Governor Snyder wanted, that was in concert with, and be careful how you say this, but it was associated with the Affordable Care Act because of the expansion possibility. Is that right?
Yeah, absolutely. The Medicaid expansion has, as of now, has increased the Medicaid enrollment by over 500,000 people. I think the last data I had was last week, which was about 580,000 people.
That's a lot of people to expand a program to. And I know we did a town hall here a few years ago. And if I'm not mistaken, you, Representative Dillon, actually stood up and said you agreed with the governor.
I've been doing that a few more times the last couple of years than I did the first 2 years. But yes, I did. And, I think he was right. And regardless of where you felt at the time, it is a reality. And we've seen a lot more people enrolled than we initially expected. The good news is, at least for the first few years, the entire cost of that is borne by the federal government. The bad news is, or I wouldn't say bad news, but the reality is, in the next couple of years, we're going to have to start paying a percentage of that. So, I think overall, it's a good investment because it keeps people out of the hospital room, allows them to seek preventative care. But it is an issue that we're going to have to work on in the budget over the next few years. And I know Rob has been very aware of that, even though it's not an impetus this year, but making sure that our budget this year puts us in a position in following years to be able to maintain those priorities.
I wouldn't ask you to name names, but how much pressure do you get from some of your colleagues? Because this is the very thing that maybe not the ones serving now, but the ones that were serving at that moment said, wait a minute, sure, the federal government pays for it now, but what happens down the road? How much concern do you find on your side of the aisle about that?
I happen to be one of those. I voted no for the Medicaid expansion for that very reason. A couple of reasons. One, I was concerned about the future, because I don't like us to get into a program where, even though it's, quote, free at first, we have responsibility down the road, and I was questioning where is that money going to come from. Secondly, I prefer a private sector solution rather than expansion of government. And the reality is over half of our youngsters are on Medicaid right now, and I understand that, and I'm glad that that's available for them. But I would like to see us design plans that get folks off of Medicaid into a private sector insurance. So it's true. We are concerned about the future, and we're talking about it already, because I don't want to wait until that particular budget year and say, oh, where are we going to find the money to do our share? Now, there are lots of the whole Affordable Care Act, Obamacare, there's lots of moving pieces. The Supreme Court 2 weeks ago heard arguments on a piece that didn't impact the Medicaid expansion, but it does impact the subsidies paid to folks that are eligible. And I checked with the Department of Community Health, and I think the number is, or the percentage is 85% of Michigan residents who obtained their insurance on the exchange are receiving subsidies. So I asked the department, well, how much is that in dollars? And they said, we don't know. I said, well, how do we find out? Well, CMS, which is the federal equivalent, may know, but they're not telling us. So if the Supreme Court, and we're expecting a decision before they finish their term in June, reverses the position taken by the Internal Revenue Service, those subsidies are gone, which creates, if you follow what's happening in Washington, we've got a plan B and we'll do this and do that. But a lot of what happens here in Michigan is impacted by what the Supreme Court does, what Congress does in response to the Supreme Court, and so forth.
I want to get to you in just a minute, Representative Dillon, but I should point out that this ruling is dealing with the federal exchanges. The language in the bill has been interpreted by some to say that only those federal exchanges would get the subsidies. We don't have that in Michigan.
That's correct.
So unless there was something changed, either at the federal level or at the state level, then that would be subsidy loss, not just in Michigan, but for several other states that don't have federal exchanges.
The majority of states.
Yeah, and if that happened, it would collapse under its own weight in a pretty short period of time if there wasn't something done in Washington, or at least that's the theory that some say.
I think it would be a very problematic decision for the many thousands of people who currently rely on those subsidies in Michigan. I've seen estimates that equates to about a $5,000 a year hit on those families that are receiving subsidies, who would then not only lose their health insurance, but it would impact the amount of money that they have available in their own pocket to be able to then contribute to the economy. So I would hope, and I think the governor has indicated that he would be very eager to, if the Supreme Court does rule in that way, to try to find a solution, because at the end of the day, this should be really about the way that this policy impacts with people on the ground, not about people's ideological differences that they've been fighting on before the Affordable Care Act was passed, and will be fighting on probably as long as there's any iteration of the Affordable Care Act in play. But at the end of the day, as policymakers, we should be focused on the people that would be most impacted immediately.
That's been 5 years, believe it or not, that has been in place, and it seems like that argument has only just begun, and I think you're right about that. I want to stop right here for a minute. You guys, I know you guys pretty well, and you work together well on these budgets because it's a serious matter and you take it seriously. We just had a discussion over the last 4 minutes in which you expressed one very different view about the Affordable Care Act than you expressed, and I didn't see anybody come to blows, fisticuffs, or any of that thing. Is there a better sense of cooperation, understanding, the ability to talk with each other in Lansing than reporters like me very often talk about?
We just do it. We just brawl after the show.
Right. You can't see what's going on under the table.
But
my shins are getting sore.
I would just say this. I think, obviously on that issue we have deep differences
you
about
could
it.
be much further apart.
Right.
But I also know that Rob and many others in the legislature, with a few notable exceptions, are very interested in focusing on solutions to problems. Sometimes that gets ground up in this kind of ideological battle we see at the federal level and sometimes at the state level. But when it comes to this budget in particular, which is nearly half of the money we spend as a state, I've had nothing but productive conversations with the chairman, and even on the areas we disagreed, we've talked about it respectfully, and I think we have tried to find areas that we can at least come to some sort of recognition that both sides' opinions have value, and that we should be looking towards moving the ball forward at all times rather than staying stagnant and showing the public that we can't do anything right.
And there are areas of common. I'm sure that Brandon doesn't disagree with me. If we could design our programs in a way that everybody was off of Medicaid, that would be a good thing.
Absolutely.
We need to protect those that are really vulnerable, but we want folks to be making the kind of money and have jobs and employment so that they don't need that safety net offered by Michigan. And quite frankly, I don't think we can afford. We're struggling with our budget, and as you know, we've had some unexpected surprises. The mega credits, the road funding bill is before us, so there's lots of priorities for every dollar in our budget, and so we're trying to find ways to manage that budget, keep it within limit or reduce its growth, and yet take care of the folks that really need being taken care of.
I want you to come back because I want to talk more about this budget after it gets completely passed, and by the time we're done, it should be out of the basic subcommittees and head to full approach. But before we go, I want to talk a little bit about this merger. The governor, talk about the merger. What is it the governor wants to put together to provide all of these services? Kind of, he describes it as one-stop shopping.
Well, I actually don't have a fundamental problem with the idea of consolidating these two departments to make the services more efficient.
And what departments does he want to?
Department of Human Services and the Department of Community Health.
And those are two big line item issues.
That would be one really big budget if Chairman VerHeulen had both of those. But I think there's some details that still need to be worked out. I've talked to the governor. I've talked to the director, who is a really smart guy. But I just expressed some, I think, helpful concerns that before we get this full merger implemented and on the ground, we should at least have some understanding about what it's going to look like. The rhetoric that the governor's used is good. The concepts that he's talked about, I think, are widely shared. But just making sure that everything functions, as we know, that sometimes when a big program gets rolled out and it doesn't roll out effectively, a la the federal exchanges, it can taint the perception of the program for a long time going forward. I don't want to see that happen. I actually would like to see it be successful if we're going to go down that road.
That's just one of many budgets being mulled over in Lansing. When we come back, we'll talk with Democratic Representative Winnie Brinks. To the point. Welcome back to the Point. Democratic State Representative Winnie Brinks represents part of the Grand Rapids area. We sat down to talk with her during this spring break about what she's pursuing in this legislative session. Representative, welcome back to the show. Let's talk for a minute about this new session because now we're 3 months or so into it. Organizationally, things have changed a little bit. You remain in the minority in both ends of the House, obviously, but from your standpoint, you are now in some leadership type positions, particularly as it pertains to some of the caucus activity. Tell me what your role is now in the House of Representatives.
Yeah, Rick, I'm really glad to be back in the House for a second term. I'm pleased to be on 4 great committees for my district. I've got health policy, education, tourism, and a new committee, workforce development. And on that one, I'm the ranking Democrat, so that's been kind of a good conversation for us to be involved in there. Additionally, I'm policy chair for our caucus, so I get to help lead the conversation and help us come together around different issues that are important to us as a Democratic caucus. And I chair the Women's Caucus, so that's a great opportunity for me to help make sure that women's voices are heard when we discuss policy.
I want to talk about a couple of these, but first let's go back to workforce development. There is a place that not just Democrats, but Republicans have been talking about for a very long time. Governor Granholm spent 8 years talking about that, talking about getting people trained, matched up to the jobs that are available. Governor Snyder has certainly talked about that. He's tried to put more money into that effort when it comes to technical training and those kind of things. Is this one of the areas in the legislature that we will see bipartisan cooperation where people will say we can agree on this direction to go?
I certainly hope so. I think it's probably one of the areas that we are most likely to see bipartisan cooperation on. The committee itself is the most equally divided among the two parties. So there's 8 Republicans, 6 Democrats, and so that bodes well for bipartisan cooperation. Yeah, so we've heard a lot of good things going on from this governor's emphasis on career and technical education to help fill that gap. And I would like to see us talk additionally more about how to improve our college attainment rates as well, our college degree attainment as well as the skilled trades, because really we're behind in both of those.
One of the things that I've been talking with members, and Republicans and Democrats alike, one of the issues when it comes to college, there seem to be 2 choices. Now, I know that there are other options because there are scholarships and there are those type of things. But you either don't go to college, or you go to college and you end up with this huge debt at the end of 4 or however many years. And we know that the paradigm has shifted about the way that higher education is funded. But if we want more kids to go to school, if we want more college degrees, if we want more trained, skilled workers to stay in the state, how do we approach that from a cost standpoint?
Well, from a cost standpoint, I think we certainly need to be willing to take measures to make college education more affordable for those who do go, and we need to try and improve our rates of college degree attainment. So we need to help people complete that degree in a reasonable amount of time to keep their debt at a minimum. So I think that it would be helpful for us to make sure that our appropriations to our state universities are keeping pace with the need of our students and their families, so that we can keep as many kids going to colleges as we can. But on the career and technical education side, I certainly think there's a lot of room for us to improve by providing some resources to get kids into those tracks toward a lucrative career as well. So the governor has put more money in his budget recommendation, I think $35 million, to put some effort into the skilled trades. I'm glad to see that, and we certainly hope that that money stays in the budget throughout the process. You can talk more with my appropriations colleagues about some of the details there, but those are some of the things we are doing to try and make that work. I think what we could do better is helping both the supply side and the demand side get what they need. So helping bridge that gap between students and families and what they know about what they want to do, what the options are, where the jobs will be in the next 10 or 20 years. We need to do better there.
I'm going to talk to you about some specific issues, but one more question about your position when you talk about developing policy. For Democrats, developing policy is one of those areas where you have the ideas that you want to support and promote, your identity and who you want to be, but you also want to support policy that is attainable, that is achievable. And in order to do that, that has to be something you can work with Republicans. So how difficult is it to kind of walk that narrow line?
Sure, it does create a challenge. We do have opportunities, though, as you mentioned, in areas of workforce development. That's not a partisan issue. A recent bill package that I'm part of on domestic violence, that's not a partisan issue. So we can work together on things like that. And so for us, the challenge as Democrats in the minority will be to find those opportunities where we can work together. And there will always be things that we are talking about and aspiring to, and making sure that folks in our districts know that we're sticking up for them and their interests as they've communicated with us over the years about what's important to them. Even if the Republicans aren't going to take those things up, we will still be championing those issues as well.
We've already talked about workforce development. Let's talk a little bit about this, about particularly supporting survivors of domestic violence. There's been a big emphasis on some of these areas. I know that one of your Republican colleagues over in the Senate, Judy Emmons, has been working on a trafficking legislation, as well as folks there in the House. This is a domestic violence issue. This isn't new, but it really appears that the legislature is taking a serious look at some subjects that for years were left into the shadows, and this would be another. So tell me about your bills.
Sure. The bills in this package really kind of help to address the economic implications of somebody who's trying to either recover from or leave a domestic violence situation, or a situation of sexual assault, or even stalking. The economic barriers that keep somebody in an abusive situation can be very significant. So a couple of things this bill package does would ensure some confidentiality of a location of a victim during court proceedings, ensure that sick days would be available to be used. If a company already offers sick days, this would be a legitimate use of those to maybe gather evidence, seek medical attention, or speak with law enforcement to help resolve those issues. What we really want to avoid is having somebody who's already been victimized also lose their livelihood, and that could really start a downward spiral for that family, that household, often involving children. So we need to help make it possible for them to get themselves to safety without putting themselves in an economically precarious position.
First time you and I ever talked, we talked about education, your passion for it, your involvement in it, and you are continuing that recently with an urban education initiative and a visit, I know, that with some other lawmakers, I think, to some schools. Tell me about your vision about urban education, because we know that urban schools face significantly different challenges perhaps than more suburban schools. And here in Grand Rapids, I think the school district has certainly made strides in trying to adapt to that, but they still face certain barriers when it comes to educating children.
Absolutely. We have seen a track history here in Grand Rapids where we've made a lot of progress in recent years. So our efforts today were to invite some key legislators in both appropriations and policy areas on education committees to Grand Rapids to have a conversation with some members of the policy branch of the Coalition for the Future of Detroit School Children, to just have some space to talk about some of the ideas that have worked here in Grand Rapids, where we've seen improved graduation rates, we've seen improved ACT scores, especially for African American and Hispanic children, and we've seen a great deal of parent engagement, and those are all vital ingredients to the success of an urban school district. So we definitely have challenges here in Grand Rapids and will continue to, but we've seen some really productive approaches, and so we just wanted to be able to share some of those ideas. If they work in Detroit and if they can bring some of those ideas to the table there to be part of the solution, we're happy that we can help.
Here we are in this first quarter of the year. As you say, you're serving in your second term, but you finished out that first term with a flurry of activity in the lame duck legislative session. And it left us with perhaps one of the most impactful elections that we have had for a while, at least as it pertains to the state budget, infrastructure, and how we go forward. And of course, that's Prop 1. We've talked with a lot of folks about it. I won't go through the details of how we got here during lame duck because as the governor and as some of your Democratic colleagues have described it, perhaps not a perfect plan, but it was the compromise that could be worked out. So now as we get closer to this vote, we continue to see numbers that don't look good on polling, though there are still a long way in between now and then. Give me your take on taking the sales tax off of gasoline, taking the gas tax, turning it to a wholesale tax, letting it rise to 41 cents or something like that, raising the sales tax overall 1 percentage point to 7%, the whole idea of not letting registration fees decline as the car ages, and whatever I've left out of this somewhat bigger package than most observers thought would come out of it, but it's what finally came out back in December. So what's your take on it?
So I guess I'm hopeful that it will pass. I think that there's some things in there that have a lot of merit. The key thing is that it would provide the adequate resources to fix the roads and infrastructure. Most people agree it would be adequate. Some people want to see more, but I think the number that we would get to if this passes is an excellent start.
And that's about $1.2 billion when it's mature, right?
Per year, right. So we need to see some resources put into our infrastructure for the good of our economy, for the good of businesses, and the ability of families to get around safely and get to work and school and do the things they want to do. So that's an important piece that would be accomplished. The way this proposal is set up, it also provides protections for consistent funding for education, which we are very concerned about being damaged if we took money from elsewhere in the budget. It also provides money for police and fire, public safety, so it retains those things that people really need from their government and protects them as well. So I think that if people understand that we protect the things we value most, like education, safety, as well as fix our infrastructure to provide that that basic foundation on which we all live our lives, I think that people will understand the merit of it and hopefully vote in the affirmative.
Now this is a difficult, we only have a few seconds left, and it's a difficult question, but how do you gauge this? How do you feel about this? Are you and your colleagues going to go out and become really proactive behind this, or is this going to have to be a matter of television ads and who shows up? Because judging turnout for this thing has got to be impossible because it's going to be a low turnout election.
Yeah, I'm not sure what the real answer is to making sure that we get everybody out. I mean, that's sort of a strategy question that a lot of experts have spent some time on more than me. I've been busy doing some of the other things we've been talking about, but there's a great deal of support for it among both Republicans and Democrats in the House, certainly, and that's the conversation we've had. Hopefully that is getting out to their constituents as well. We're
back with more To the Point in just a moment. Our thanks to all three representatives for being our guests this morning. Obviously, during spring break, we taped some of these in advance, and next week is another such program when we'll introduce you to a freshman senator, Senator Curtis Hertel from the East Lansing area. To the point.